in an arena where conventional medicine has nothing to offer, if you engage the immune system to actually target the tumor, then what happens is you actually, as one of the viewers there said, you found the holy grail of immunotherapy.
Yes, and I want to unpack that.
Okay.
I want to finish your intro because
Yeah.
you kind of like
Oh, I'm
took
sorry,
over on me. No, I think it's great. But Williams Cancer Institute is where you're actually practicing now as the medical director. But I do want to make sure that your credentials get listed on here because I want to make sure that people understand the validity of what you're saying, and some of that just comes from your pedigree here. Originally trained and is board certified in OBGYN.
I was a pelvic floor surgeon, that's correct. So I was primarily a surgeon.
So a surgeon, so this is not the reason why I bring that up is because in this space there's a lot of woo. And
woo-woo.
we get the woo in the
about.
space, and the people who are like, yeah, but, and so when I'm actually talking to someone, and you're an MD?
That's correct.
Is that correct? So
and an MD homeopath.
So an MD who's also homeopath and was a surgeon.
Correct.
So when I see people come from Western medicine and then move into more of a naturopathic space, I never see them go the other way. And it's very interesting. Like I never see anybody go from naturopathy into the medical world, like because I see go the other way. I never see them go back. And that there's data in that, I'm sure, somewhere as well. But the fact that you actually hold the credentials as an MD and yet still practice homeopathy more than anything else. Since 2006, your career is focused on integrative medicine and oncology, frequent educator on approaches like high-dose IV vitamin C, hyperthermia, always pressing for strategies patients can actually use. Also the author of Breaking the Cancer Code and host the podcast Practicing by Dr. Nathan Goodyear, obviously you. Around here we value evidence-aware, actionable tools, and that's exactly the lane that you stay in.
Correct.
So everything that you've explained so far in your introduction of you makes sense of that. But getting into that credentialing side of things, I love when I'm talking to somebody who's not, I don't want to use the word just a naturopath, because if a person studied naturopathy or a person is a holistic practitioner by training, I would say that they're already biased towards the world of homeopathy.
We're all biased in a way, right?
Well, I would say that being trained as an MD, you're not biased towards homeopathy. Your bias
definitely not.
Would have been in the other direction, and yet you've moved in this direction. So the course corrected, I'll say corrected.
I think that's fair.
That's fair. Accurate. I mean, but your course corrected, but I don't think your course corrected based on, you met a person of influence. I think it's data driven.
Experience driven. When you go through training, in medical school, we're taught a bunch of facts, a bunch of books. I can remember our microbiology course was a whole semester. The professor bought in basically a box. It was nothing, paper still. That was way back when.
I prefer, my college education was in paper too, and I liked it much better.
We were actually the first medical school class that they required a laptop, but we didn't use it for anything because there was nothing to use it for. But anyways, so we had all this to go through, but the application of it. So then when we get into residency or people go on to fellowship, we don't really follow these patients through the duration of the treatment. So we get just small points, small bits of windows of, is this therapy working, is it not? Then when you get out into clinical practice, you actually go, these therapies actually do help for some people, and others they don't. So I had to very quickly decide, am I going to be a patient for some people, it's going to be a doctor for some patients, or am I going to be a doctor for all patients? And so what I was given in conventional medicine is an answer for some patients, a help for some patients. And I tell patients all the time, I said, look, if you walk outside and you break a hip, no amount of vitamin D is going to help you. You need surgery to repair that hip. It's just what it is. If you have metastasis to the brain and there's cerebral edema, you have to shrink that. It's life-threatening. It must be done and must be done now.
Yes.
You don't want radiation, but if we do stereotactic and then we add in other natural and integrative therapies like Boswellia to reduce that and stay away from the steroids, which, by the way, Boswellia has been shown to be equally effective as dexamethasone, then we can reduce the side effects, augment, and allow the patient to move on to the next day to actually then promote healing. So I had to decide, am I going to be a patient for a few or all? And so in that, I started asking questions that conventional medicine didn't have the answer for. And so it forced me to answer or look for questions and look for answers outside of that conventional strategy. I had a good friend that was a compounding pharmacy that had already been corrupting me. Joe, if you're out there and you're watching this, you corrupted me, dude. You did. No, I love him. So we talk about repurposed medications all the time. But, and so he poured back into me. And then from that standpoint, I started reaching out. And it was through the course of these types of education, ongoing and learning. In fact, I've learned more, Mark, outside of my residency and outside of my medical training than I ever would have inside. And it's taught me.
As it should be, by the way.
Absolutely. It's taught me, go back, medical school and residency taught us what to think, the conformity of thought. What I've done outside of that, not because of what I've done, but because of everybody that I've met. It's taught me to critically think. It's taught me how to think. And so in that process, I've learned to help all patients, not just some, but all. And that's via natural, holistic, integrative, conventional. We need all to bear when we're dealing with stage 4 cancer.
I 100% agree with all of that. And I think that you used a word in there that I want to highlight in a moment, but I believe that people are treating, my sister, I just had Christy Kessler in, if you know Christy, just had her here on the podcast. And I actually introduced her to my sister who's got breast cancer right now. And she's in this struggle of like, I've got people in my own family that are telling me that there is a metabolic approach to helping deal with this. And my doctor is telling me they've done surgery on her 3 times and now they're wanting radiation. And I'm like, look, I'm not telling you what they're saying is wrong. I'm telling you that the holistic approach to treating this is wrong. Because there is no one solution. This needs to be an integrative solution that does all of this. And it's like, and I finally got her to talk to Christy. And I was like, look, she's an oncologist who practices holistic treatment now. So she's not standing in my world. She's not standing in your doctor's world. She's got a foot in both worlds.
That's correct.
Would you listen to a person who maybe you can see as having a more holistic approach? Because as we're dealing with this, and another friend of mine who's dealing, I also talked to Christy about it. It's like, should you choose, and I want to pivot into this immunotherapy conversation because like he was recommended, he's got multiple myeloma and immunotherapy is an immediate response. And it's like, okay, I'm great with immunosupport. I think that's fantastic. But what are we doing to support the body during immunotherapy? And it's like, but it's this very binary mindset that people have. It's this or this. And when I'm involved in a conversation, I'm always trying to pull those two things closer together and saying, we live in this binary world that it's yes or no and black and white. I'm like, no guys, like this is not an and or, it's an and. It's a you can do this and this, and sometimes this is more appropriate than this, and sometimes this is more appropriate. And I say like if I'm not a big fan of pharmacology as a first approach to something, but if I'm rushed to the ER and my leg is broken open, bring on the pain meds.
That's right. Or you start having chest pain, you go in, they do an EKG, guess what? That's or you're in an automobile accident, like you said, 100%. Open fracture. It's exactly what we need them for.
Correct.
But what conventional medicine, and this is what I learned through experience, Mark, was that it doesn't teach us how to heal.
Yes.
It teaches us how to intervene, how to manage acute, catastrophic situations, and hats off for that. But the word physician, you know what? It's from a Hebrew word, Rapha. It literally means healer.
Yep.
And so if we want to be true to our origin, we need to heal. And conventional medicine wasn't bringing that. And so I wanted to, as I said, be a doctor to all patients, and I wanted them to heal. And by the way, that's the best strategy for cancer prevention, is help the body heal itself. There was that old, great saying, physician, heal thyself. It should be rephrased, physician, teach patients to heal thyself. And then from that standpoint, then we've done our job. And we've, though, actually negated the need for conventional pharmaceuticals.
Right.
And therein then lies a problem.
I got a phone call recently from the son of a friend of mine from college who's now a PharmD. And he's been practicing as a pharmacist for almost 10 years now. But he follows me on Instagram and stuff like that. So he sees a lot of the stuff that I'm talking about, and he's, watched podcasts and stuff like that. And he's like, can we talk? And he's like, because I'm so over this entire career. He's like, I've got a doctorate in pharmacology, and all I'm doing is passing out pills all day long, helping people eradicate symptoms and never actually solving anybody's health problem. And he's like, and I can't in good conscience do this.
See, there's this process in conventional medicine that's protocol driven. And it's within the business kind of structure and framework, because within the protocol, you can really control what's done. And so from a business model, and we're getting a little bit off target, but I think it's important and relevant here, you can control how things flow. You can control the traffic, you control the profits, you control the losses. And it creates a very manageable, very large system.
It's repeatable.
Exactly. And it helps some, but it doesn't help others. What we need is actually a precision, personalized. You use functional medicine, integrative. That word integrative means restore, remake, make whole. If we're cutting body parts off, that's not doing any part to make whole the individual.
Right.
Now, we might need that to reduce tumor burden, but we'd rather not. If we can save breast, if we can save prostates, if we can save cutting organs out, that is a person that is going to fare better, because that surgery compromises the immune system. That surgery actually can set the stage for local recurrence or metastasis. That surgery can actually advocate for what's called concomitant tumor resistance, where distant metastatic sites that are actually dormant now lose the suppressive action of that dominant tumor, and boom, they blossom. So we have to understand that surgery can be an answer, but we need to work for it to never be the answer if we can. And I was a surgeon. Chemotherapy, it's born out of war. That's literally where it came from. World War I, World War II.
Napalm the body.
That's right. It turns the body into the battlefield. And guess what? The immune system front and center. So this, talking about breast cancer, it's been shown to actually shrink primary breast cancer tumors, yet damage the immune system and spread it. So the very tool that is used to destroy the tumor sets the stage for it to spread through damage to the immune system. And why is that important? 90% of morbidity and mortality in cancer is when it spreads.
Yep.
So what are we doing? Not good.